A new wave of healthcare reform is sweeping through Washington, and President Donald Trump is once again at the center of it. Supporters call his new policies bold, efficient, and long overdue. Critics warn they could push millions of Americans off their insurance and reshape the nation's healthcare system for decades. The plan, known as the One Big Beautiful Bill, or BBB, is part of Trump's broader domestic agenda, combining tax changes with sweeping revisions to programs like Medicaid, the Affordable Care Act, and Medicare. At the heart of these reforms are deep cuts to Medicaid and new work requirements for recipients. The bill also rolls back Affordable Care Act subsidies that helped millions afford private insurance, eliminates certain Medicare innovation programs designed to control drug prices, and expands price transparency rules that force hospitals and insurers to show real costs before treatment. The administration says these changes will promote personal responsibility, curb waste, and increase competition in the healthcare marketplace. But independent analysts say the numbers tell a different story. According to the Congressional Budget Office, more than 10 million Americans could lose health coverage over the next decade under Trump's new law. Other studies estimate that as many as 12 million people could be dropped from Medicaid alone. Despite promises to save money, the CBO projects the legislation could actually add more than $3 trillion to the federal deficit over 10 years, meaning more people uninsured and higher national debt. The human impact is already becoming clear. Across the country, rural hospitals are bracing for budget shortfalls as Medicaid funding shrinks. Many facilities rely on those dollars to stay open. Without them, entire communities could lose access to emergency and specialized care. Nurses warn that patients aren't getting healthier. They just avoiding treatment until it is too late. Families who buy their own insurance face higher premiums as Affordable Care Act subsidies expire, forcing some to go without coverage altogether. Not all parts of the reform are controversial. The push for price transparency has been praised by some health economists as a positive step toward accountability. For the first time, hospitals and insurers will be required to list what procedures actually cost, allowing patients to compare prices before seeking care. Yet experts caution that transparency alone won't fix a system where most insured Americans never see the full bill. For those on employer or government plans, the benefit may be limited. Politically, the Trump administration frames these reforms as an effort to reward work and reduce dependence on federal aid. Opponents, however, see a calculated move to cut social spending and shift the financial burden to states and families. Many of the new rules, especially those involving Medicaid eligibility and work verification, are already facing legal challenges in federal courts. The rollout is complicated, costly, and controversial. In the end, the truth lies between the talking points. The reforms will almost certainly reduce federal spending on health programs and increase transparency in some areas. But most independent analysts agree that millions will lose coverage, deficits will grow, and those with the fewest resources, low-income families, the elderly, and people with disabilities, will be hit the hardest. Healthcare in America has always been political, but behind the numbers and slogans are real people who depend on these programs to survive. The choices being made today will determine not only how much we pay for care, but who gets it and who gets left behind.